Big-headed. Health workers rock as Harry and Meghan brag about medical issues in letter to WHO. In the new video, Prince Harry highlights the parallels between the struggles for access to HIV medicines and inequality surrounding the rollout of the COVID vaccines and boosters. He co-voices the footage with UNAIDS Executive Director Winnie Byanyima. The video is a part of a project for the People's Vaccine Alliance as part of a World Health Organization and UNAIDS event. Harry said, "There are striking parallels between COVID-19 and another deadly pandemic. One that emerged 40 years ago, HIV." The video also features clips of Prince Harry's mother, Diana, Princess of Wales, meeting AIDS patients. The Duke of Sussex added, "This is a story about how corporate greed and political failure have prolonged both pandemics and what we can do to stop it. By ending vaccine monopolies and sharing technology, companies in the developing world can start producing COVID vaccines too, break the monopolies, deliver a people's vaccine." Alongside the video, Prince Harry also wrote a letter to WHO Director General Tedros Adhanom Ghebreyesus and Ms. Byanyima. In it he wrote how deeply grateful his mother, who was known for helping to break stigma around HIV and AIDS, would have been for their achievements. The letter was read out by the WHO's Director of Global HIV, Hepatitis and STIs Programs Dr. Meg Doherty at the event. Harry wrote, "On this World AIDS Day we recognize the 40 years that have shaped life for many. We honor those whose lives have been cut short and reaffirm our commitment to a scientific community that has worked tirelessly against this disease. My mother would be deeply grateful for everything you stand for and have accomplished. We all share that gratitude, so thank you." In sharp comparison he called the rollout of the COVID vaccine globally a spectacular failure. The prince called vaccinating the world a test of our moral character and said the world was failing. He said, "Similar to the AIDS crisis, we've yet again revealed over the past year that the value of life depends on whether you were born and or live in a rich nation, or a developing country. Now more than ever, the voiceless majority of the world needs to be heard and the onus is on our leaders to end this pandemic." He warned that repeating failures that surrounded and worsened the AIDS epidemic would be a betrayal of the next generation. He called on world leaders to learn lessons from the past where millions died unnecessarily due to unequal access to treatment. He said, "Are we really comfortable repeating the failures of the past? Everything I've learned, from the youth of Centibale, tells me not. They see how repeating these mistakes is destructive and self-defeating. It is a betrayal of the next generation. Let's spend today celebrating and building on the work of champions who turned what was once a death sentence into a manageable condition. Let's spend tomorrow continuing our efforts to save lives and make a difference." The COVID-19 pandemic was far from over, but high-income, high-vaccination countries were already starting to talk about future pandemics, while turning a blind eye to those that continue to impact poorer regions. This will only prolong the pain of existing pandemics, placing millions of lives at risk. It is striking to now see the world's leading AIDS activists are also leading the call for COVID-19 vaccine equity. Vaccinating the world is a test of our moral character and we are experiencing a spectacular failure when it comes to global vaccine equity. Similar to the AIDS crisis, we've yet again revealed over the past year, that the value of life depends on whether you were born and or live in a rich nation, or a developing country. We've known for some time, thanks to medical experts, that if we are unable to meet agreed targets to vaccinate 40% of every country's population by the end of the year, and 70% by next September, potentially more dangerous COVID-19 variants are likely to arise. Yet, here we are. While it's too early to know the full extent of the risk that the Omicron variant poses, which we only know about thanks to the experts in southern Africa identifying it, there is no doubt that its emergence is of deep concern. Now more than ever, the voiceless majority of the world needs to be heard, and the onus is on our leaders to end this pandemic. Anything less is self-defeating.